Welcome to the Hopkins Health Wellness Center clinic tour. We're going to start from the outside of the building. On the right side of the building is the clinical services wing of the building. On the left side is the community fitness center. The first thing you come to is the Well for Life Health and Wellness store. We've got health and wellness products for the clinical members as well as the fitness center members, a smoothie bar, and braces, supports, other resources for patients. We're going to make our way from there down the hallway into clinical services. The first place that we come to is the reception area for clinical services. This is one of the waiting areas, and there is an awesome team. Next, we're going to go into the chiropractic treatment area. Hey, what are you up to right now?
I'm just doing patient notes. Favorite patients are infants and babies.
Okay.
I really like athletes, shoulders, extremities, knees, IT bands, rotator cuff. It's actually pretty fun working on disc bulges and herniations.
We have a blend of open treatment areas as well as closed rooms like this family room right here. And this is another treatment and exam room that we have. Okay, let's make our way down the hallway to the exam and diagnostics area. On the right side is a typical exam room. And then we're going to go across the hall to the diagnostics area.
My name is Heather. I am the rad tech here.
We also do body composition testing. And this is Dr. Fox doing x-ray reports.
Here, and I couldn't stand in there anymore. My leg hurt so bad. And the wife heard about the Hopkins Health and Wellness Center from Bernard on KQRS, and just said we got to do something. You know, I've been to other places. I've been to 4 or 5 other places. I won't name them, but it was, you know, they never found out what was wrong with me, and I was just amazed at what you figured out for me in like one visit. So we did the DMR method, which is a 10-week program, and it starts out as you start out doing light exercises and a little bit of traction and chiro, and I was in 3 times a week, and then that changed after like 3 weeks to 2 times a week, and they started doing different exercises with me to try to build my core muscles. It's helped. I would say 90% of my pain has gone, and no surgery is in the future, and so I'm actually real grateful for it.
Okay, let's make our way upstairs. First, we come to a reception area for massage and acupuncture.
Hi, my name is Frank Harris. I'm a massage therapist at Hopkins Health and Wellness Center. My favorite thing about my job is seeing the changes in the people in the time that they come in. Watching them come in, not feeling good, not smiling, and watching them, after a few sessions, walk out completely happy. Behind Frank, we've got a yoga studio. We have other fitness classes that take place in that area. Down the hall, we have a typical massage room.
I do Swedish therapy technique, trigger point therapy, as well as myofascial, some sports massage.
Okay, from there we're going to go down to physical therapy and sports rehab department. This is the waiting area for that department. And now we're going to make our way down the hallway to the private PT treatment rooms.
So what's your favorite type of case to work on here, Kelly?
My favorite would be an orthopedic sports medicine patient.
Let's go down to the PT staff office.
Jay, what's the most rewarding part about your job?
The best part about the job is getting people better and getting them back to doing the things in life that they had lost because of whatever pain or injury they had. So when somebody comes in and tells me that they can drive to work without having to get out of the car and stretch, or they can play with their kids, or they're back on the golf course, you're making an impact on their lives, and that's really all we want to be able to accomplish for them. We want to bring them back to wellness.
From there, we're going to go back through the reception area into the open area of the PT Rehab Center. We have a sport court as well as clinical area with treatment tables where you'll see some of the physical therapy staff working right now.
What do you have there in your hand?
A weighted ball.
All right.
We use quite often for shoulder surgeries to help reconstruct them after, but not until they're far enough post-op that they can actually tolerate weights.
These are the decompression tables we use for the DMR method. And there's also fitness classes after hours.
Let's go. All right, do you work here?
I do.
What do you
Work
do?
down at the Snap Fitness, Wealth for Life store, personal training, detox programs, weight loss programs.
For some reason, all of a sudden was working out and then couldn't. I don't know what happened. I couldn't drive. I couldn't sit down for very long. I could stand all day long. I couldn't sit. And now I'm doing way better than what I was. I can do all my activities again. I can drive here. I'm doing fine with all that.
Okay.
I mean, this, for physical therapy here, the hands-on that they did for me was more than any place I've ever gone. And then as far as getting deep into the spots that needed to be done, the muscles, which now I believe was a huge part of everything.
Okay, we're going to make our way from the sport court down the stairway into the fitness center. This is a full fitness center, mostly Cybex equipment. We've got a large community membership. There's some people there working out right now. Our physical therapists and chiropractors also use it for patient care.
What's your name?
Seth,
What do you do here?
I'm a personal trainer.
Right. Do they call you Superman? By
Okay, we're gonna go from there back into the Well for Life Health store, and we have just made a giant circle all the way through Hopkins Health and Wellness Center. What do you think, Jose?
The whole team, we all get along really well. The whole chiropractic, physical therapy team, massage therapy, acupuncture. We have a smoothie bar, and we have access to Snap Fitness, so people can, learn workout routine at home. I love the whole getting everybody involved because, in my opinion, your whole body works as a whole.
I was in a car accident in Washington State, and I broke my neck and my back at the C6 and T3 levels and had to wear a halo for just shy of 3.5 months. Working with the variety of specialists, a neurosurgeon, chiropractor, and physical therapist, I think that was the best way to do it. Neurosurgeon knew the microscopic medical, but that can only go so far as to building confidence as to how well you're going to heal, and chiropractor and physical therapist really helped out in explaining how that works in the spinal alignment and how that can dramatically change or affect at least the recovery and the total outcome of the recovery from my injuries.
Oh, that's great, man. Well, you know what? You're the one that did the most work, and good job. So it's been great working with you, Christian.
Happy to be here.
We are Hopkins Health and Wellness Center, an enthusiastic and compassionate team focused on patient care and wellness education. Thank you for taking our video tour.